Hello, my name is Nicholas Tolsche. I'm a Auburn University FNP student. Today I'll be doing an advanced head-to-toe assessment on a patient. Before the patient entered the room, I assessed vital signs, which included a blood pressure, heart rate, respiratory rate, temperature, and oxygen saturation. All were within normal limits. Next, I obtained a height and weight and calculated a BMI, which was also within normal limits for the patient. We also did a visual acuity on the Snelling chart. Patient's vision was 20/20 without corrective lenses. I also assessed his gait on arrival, which was steady. Asked the patient to empty his bladder and put on a gown before the examination. General appearance of the patient, well-groomed, well-kept patient, no odor noted, clean skin, attire was appropriate for the day. Let's see, skin is pink, dry, and intact. No clubbing of the nails, no spooning of the nails, no lesions or bruises noted to the hands. Capillary refill less than 3 in all fingers. Next, I'll inspect the head and scalp. Face is symmetrical. There's no bruises or lesions noted to the face. Hair color is dark in color, coarse, thick hair. Next, I'll palpate the face and the scalp. I'm going to palpate your facial bones. I'm going to palpate your frontal sinuses and your maxillary sinuses. No tenderness noted. No scalp was normal cephalic. No lumps, no lesions, clean without odor. Facial bones were non-tender. Next, I'm going to examine, do cranial nerve number 5. I'm going to palpate your temporal mandibular joint and ask you to clench your teeth down. All right. Cranial nerve number 5, the trigeminal nerve, is intact. Next, I'm going to check cranial nerve number 7, which I'm going to have you open your mouth, stick out your tongue, raise your eyebrows, clench your teeth, smile, frown. All right, cranial nerve number 7, the facial nerve is intact. All right, next I'm going to access another part of cranial nerve number 5. I'm going to get you to close your eyes and we're going to check sensation of your face. Tell me what you feel, if you feel anything.
Rubbing.
Yeah. What's the texture?
Soft, cotton, gauze.
Okay. All right. Cranial nerve number 5, the facial nerve is intact. Test for sensitivity of the skin. Next, I'm going to examine the nose. The nose is midline. Septum is midline. I'm going to take a look inside the nose. Septum is midline. Mucous membranes are pink. I'm going to test the patency of each nostril, if you can inhale and exhale. Bilateral nares are patent. Next, I'm going to test cranial nerve number 1. Close your eyes. Can you tell me what you smell?
Alcohol.
All right, cranial nerve, the olfactory is intact. Next, I'm going to examine the lips and mouth. Stick your tongue out and you raise it up. Any tenderness or no lesions, no sores within the mouth. Lips are pink and moist. Buccal mucosa is pink and moist. Appropriate and intact. His teeth are appropriate and intact, and without lesions or discolorations. Soft palate, pink. bony provinces are midline. Tonsils are pink at +1 with no exudates. Next, I'm going to test cranial nerve number 9 and 10 by checking a gag reflex and having you say ah, okay? Let me grab a tongue depressor. Get you to, you get the thing. Really? Cranial nerve number 9 and 10, the glossopharyngeal and the vagus nerves are intact. Next, we're going to check cranial nerve number 12. I'm going to get you to stick out your tongue and lift it up and down and side to side. All right, good tongue movement. That shows that cranial nerve number 12, the hypoglossal, is intact. Next, I'm going to examine the eyes. The exterior of the eyes are midline with the outside of the ears. Close your eyes. Any tenderness? No tenderness with the eyelids. Eyebrows run the full length of the eyes. Next, I'm going to examine the eyes with the ophthalmoscope. Eyes are symmetrical. The conjunctiva is pink. Sclera is white with no redness, no signs of jaundice. Conjunctiva is also shows no signs of jaundice as well. It is pink and moist. We had the iris is green in color, and pupils or perla when light was shined. A red reflex was elicited, and the fundus is visualized. Was visualized, I'm sorry. Next, we're going to do cranial nerve number 2, which we already assessed with the visual acuity chart, and now we're going to do the cranial nerve number 2 and 3, which is the ocular sensitivity to light. Just watch the light. Just keep your eyes straight for me. Cranial nerve number 2 and 3, the optic and oculomotor nerves are intact. Eyes react to a combination and convergence. Next, we're going to try do cranial nerve number 3, 4, and 6. We're going to test peripheral fields and vision, and we're going to check the 6 fields of gaze, okay? Just look at me right here. Tell me when you see my fingers moving. Okay, all right? And next, I want you to follow my finger with just your eyes. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens nerves are intact. Next, I'm going to examine the ears. The ears are symmetrical. The auricle and pinna are soft. Any tenderness? No tenderness noted. No lesions or bruising noted to the ears. Next, I'm going to look inside the ears. External canal, clean, dry, no drainage. There's no redness noted. The tympanic membrane is gray. cone of light was visible, no excess serum noted in the canal, and no redness noted in the tympanic membrane itself. Next, we're going to do a whisper test. I'm going to stand over here and whisper a word to you and see if you can hear what I say.
Tiger. Eagle.
All right, whisper test was positive. Next, we're going to assess cranial nerve number 8 with the Weber test. I'm going to use a tuning fork and tell me if you hear it in both ears or just one ear. All right. Cranial nerve number 8, the auditory nerve, is intact. Next, we're going to do the Rhine test. We're going to test with bone conduction versus air conduction. Air conduction should be greater than bone conduction. So I'm going to hit this tuning fork, hold it up to your mastoid process. Tell me when you stop hearing the sound. I'm going to move it to your ear, and then tell me when you stop hearing the sound again, okay? Positive Rhine test shows that air conduction is twice as strong as bone conduction. Next, we are going to, I'm going to assess the neck. Hold your neck up for me. Trachea is midline. No signs of bruising, lesions in the neck. Let's do a range of motion of the neck, side to side, touch your shoulders, up, down. Any pain with movement? No pain, movement with neck. Next, I'm gonna do the lymph nodes. Let's see here. We got the periocular, postocular. Tell me if you're feeling any tenderness, by the way. We got the occipital, parotid, tonsillar, submandibular, submental. We got the anterior cervical, posterior cervical, and supraclavicular. Any tenderness? All right. No tenderness noted in any of the nodes. Next, we're gonna do I'm gonna palpate your trachea. Any tenderness? Can you swallow for me? Any difficulty swallowing? No difficulty swallowing. Next, I'm going to palpate the thyroid glands. Turn your head down and towards me. Swallow. All right, do it the opposite way. Swallow. No tenderness noted in the thyroid glands. Next, I'm going to palpate and listen to your carotid arteries, okay? +2 carotid arteries, strong and bounding. I'm going to listen here for any breweries too, okay? I'm going to listen with the diaphragm of the stethoscope. Actually, the bell, I'm sorry. No breweries noted to the stethoscope. Next, I'm going to, there's no jugular vein pulsations noted also. Next, I'm going to get you to, we're going to test cranial nerve number 11. I'm going to get you to push against my hand with your head this way. All right. Now do the same, and I'm going to get you to shrug your shoulders. Cranial nerve number 11, the trapezius accessory nerve is intact. Next, I'm going to assess the back. I'm going to get you to roll around to your back. Right now, skin is, on inspection, skin is pink, dry, and intact. No bruises, lesions noted. I'm going to palpate your spine. Any tenderness? At the 10th rib, I'm going to get you to take a deep breath. Respirations are symmetrical, equal chest rise on inspiration. Next, I'm going to percuss all lung fields. Resonance heard in all lung fields. Next, I'm going to test tactile feminus. I'm going to get you to say 99.
99.
Say it again.
99.
Say it again.
99.
Tactile firmness noted in lung fields. Next, I'm going to percuss diaphragmatic excursion. By doing that, I'm going to, just stay where you are, I'm going to get you to take a deep breath in and hold it. I'm going to percuss down, take a deep breath in and hold it. I'm going to percuss down, and I hear resonance, and it changes to dullness. I'm going to make a mark. All right, you can let out. Now I'm going to get you to take a deep breath in and exhale. And hold it. Exhale and hold it. Now I'm going to percuss from dullness until I hear resonance. And now I'm going to measure that. It should be within 3 and 6 centimeters. And it is 3 centimeters. I would repeat that for the other side. Take a deep breath in. Make a mark. All right, take a deep breath in and blow out and hold it. Measure that again. It should be within 3, and it is 3, between 3 and 6 centimeters. Next, I'm going to auscultate the lung fields in the back, posteriorly, laterally, and then we'll turn around and do it anteriorly. All right, take some deep breaths. Adventitious sounds heard. Lungs were clear bilaterally. Next, I'm going to percuss the CVA, or the cervical vertebral angle, costovertebral angle, I'm sorry. Tell me if you feel any tenderness. Get you to swing around for me. Next, the anterior of the chest is clean, dry, pink, dry, and intact. No lesions, no bruising noted. Next, I'm gonna do some tactile firmness on the front and get you to say 99.
99.
Say it again.
99.
Alright, tactile firmness heard on the front anterior of the chest. I'm gonna percuss the anterior of the chest now. Resonance heard throughout the lung fields and the anterior of the chest. Next, I'm going to palpate the anterior of the chest. No tenderness noted on palpation of the anterior of the chest. Next, I'm going to find the apex apical pulse, which is the 5th intercostal space, mid-clavicular line. Apical pulse present at 2+, regular and strong. Next, I'm going to auscultate the anterior lung sounds. Next, I'm going to auscultate for heart sounds at the 5 points: the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. I'm going to listen with both the diaphragm and the bell. No murmurs, S1, S2 heard in all areas of the heart. Next, we're going to check pulses. I'm going to do your carotid pulse we already felt. I'm going to do your brachial pulse, +2 and strong, radial pulse, +2 and strong, and femoral pulses, +2 and strong. Next, I'm going to get you to lay back and we're going to do an exam of the abdomen. General assessment of the abdomen. It is pink, dry, and intact. No scars, no lesions, no bruises noted to abdomen, no pulsations noted to abdomen. Next, I'm going to auscultate the abdomen. Listen in all 4 quadrants. Normal tonic bowel sounds heard in all 4 quadrants. Next, I'm going to listen to the abdomen with the bell of the stethoscope for the aortic, renal, iliac, and femoral arteries. No no breweries hurt in any of those arteries. Next, I'm going to check your abdominal reflex. I'm just going to scratch this against your abdomen towards your belly button. Positive abdominal reflex. Next, I'm going to just percuss your abdomen in all 4 quadrants. Dullness heard over all solid organs. Tympany heard over all air-filled organs like the stomach and the intestines. Next, I'm going to percuss to see if I can find your length of your liver. I'm going to percuss down from the chest, from hearing resonance to dullness. I'm going to make a mark. Next, I'm going to percuss up from tympany to dullness. I'm going to make a mark, and then we're going to measure. It should be between 6 and 12 centimeters, and yours is exactly 6.5. And we would measure that at the mid-clavicular line, 10th rib down is what it would feel. Next, we're gonna percuss to feel the spleen, which we hear dullness. Next, I'm gonna just do light palpitation of the abdomen. Muscle tone is good. Abdomen is flat. No tenderness noted. Next, I'm going to do deep palpation. Tell me if you have any tenderness or any pain. Take a deep breath in. I'm going to try to palpate the liver. The liver. The border of the liver is felt. Able to palpate the spleen. Next, I'm going to try to palpate the aorta. Let me slide my hand under here. Take a deep breath in. Unable to palpate the aorta. Next, I'm going to try to palpate the kidneys. Take a deep breath in. Able to palpate the kidneys. Come on, sit up for me. Next, I'm going to start examining the extremities, starting off with the arms. No bruising, lesions. Skin is pink, dry, and intact in both of the arms. Gonna squeeze my hands. Grips are strong. Radial pulses were already intact. We're gonna check deep tendon reflexes while I'm here. We're gonna start off with brachial. Radial. Alright, we're going to do, sorry. Alright, we're going to do Achilles. And we're going to do, just relax your feet, we're going to do a Babinski sign, which was positive. Positive Babinski all deep tendon reflexes were 2+. Next, I also forgot to mention hair distribution on the arms and the legs are evenly distributed bilaterally. Next, I'm going to do the check range of motion in the shoulders. If you can just raise your arm up, back, forward, across. Any pain? What about this? Up, back, forward, down, across. Any pain with range of motion? Range of motion is no pain with range of motion and bilateral shoulders. Next, we're going to do range of motion of the elbow. Up, down, side, side. Just move it around. Any pain? Okay, let's do this one. Any pain? All right. No tenderness in the elbows. Epitrochlear nodes. No tenderness noted to those. And +3 capillary refill. Next, we're going to move on to the legs. Good muscle tone. Legs are pink, dry, and intact. Can you feel? All right, push against my hands and then pull away. Positive. Patient is positive for Homan sign. Negative Homan sign, I'm sorry. Next, we're going to test sensation of the legs. Tell me if you close your eyes. Tell me if you feel something sharp or soft.
Sharp, sharp, soft, soft, sharp, soft, sharp, sharp, soft.
All right, sensation intact in bilateral legs. Capillary refill noted to toes. And can you feel me touching the bottom of your feet? And good sensation noted to bilateral feet. All right, let's do range of motion of your knees. Get you to straighten out your knees, the legs, bend it side to side if you can, or back and forth. Can you rotate your legs? All right, full range of motion and bilateral knees without any pain. Let's do your ankles. In, out, up, down, and full range of motion without any pain in bilateral ankles. I forgot to do range of motion in your hands. Let's do that real quick. Let's do range of motion of your wrist, in and out, up and down, and then flip them in and over. Next, we're going to check for correlation. I'm going to get you to touch all your fingers with your thumb, and then touch your nose. Good correlation noted bilaterally. Next, we're going to stand up and we're going to check range of motion of your spine. Get you to bend over for me. All right, no scoliosis, kyphosis noted of the spine. Get you to lean back. Lean to your side. Lean to this side. Full range of motion without any pain to the spine. Get you to lay we're going to check range of motion of your hips. All right, go back. Do it with their other leg. All right, go back. Full range of motion with the hip without any pain. Next, we're going to do the Romberg's test, which is I'm going to get you to hold your arms down by your side, close your eyes. And do you feel like you're swaying or moving back and forth? We had a negative Romberg's test. I'm trying to think of anything I missed on your assessment before. supposed to check, listen to your heart, which you sitting up, which I did. I was supposed to listen to your heart with you laying down. Let's do that real quick. I'm supposed to listen with the bell and diaphragm, which you sitting and standing. CVA tenderness, we did that, Alright, I think that concludes my physical exam, and thank you guys for watching.